Very curious about how the vaccine distribution is going for you in New Jersey.
Well, thanks for having me, Taylor. The vaccine rollout is actually moving along quite nicely. Holy Name was able to open in partnership with the Township of Teaneck, who made their community center available to us, one of the most efficient vaccine centers in the entire state and the whole region. So that, coupled with some software that Holy Name designed to facilitate the process, allows us to easily do 3,000 a day in an 8-hour day. We could go significantly higher, up to 5,000, if we extend those hours to 10 or 12 hours a day.
Has that distribution been as smooth as we are led to believe it has been?
So once we get the vaccine, it's a smooth process. The most erratic component so far has been the inconsistency in vaccine supply to us. And so that's been a little frustrating. We will only open up available scheduled appointments when we know we have the vaccine here on site, because it's very complex in prepping and administering the vaccine. And so week to week, the volume of vaccine we receive can fluctuate pretty large. And so that adds some chaos into the overall ability to have a consistent schedule.
Are you seeing the demand start to show up for these vaccines? Because that was an early concern, right? Overcoming that hurdle for that initial demand.
Oh no, the demand is far, far greater than the supply. So when we opened our first website in its very infancy, I mean, it's evolved very quickly in the weeks past. We had 1.2 million hits to the website on a Sunday afternoon when it first launched. We now have consistent activity there. We changed the format a little bit. We have over 100,000 people registered in our queue, and that's after having given over 60,000 doses to vaccines to people. So it's robust. People are still very interested in getting the vaccine.
You know, you're a CEO of a major hospital, and it's so interesting to talk to you about what you're seeing on the ground. But we'd also be remiss, given here it's Bloomberg and it's Bloomberg Technology, about the finances as well. What were those moments like when, in the last year, you know, there were a lot of hospitalizations for COVID, but a lot of elective surgeries were being delayed? How does that impact you on a financial level?
Oh, it was a fiscal year unlike any. I'm here at Only Name 34 years. We never had a year like we had in 2020.
Wow.
If it wasn't for the support we got from the federal government, from the CARES Act money that was able to come in, it would have absolutely been disastrous. We shut down, as you said, all normal business for the longest period of time. We were COVID only, and so that hurt. And then it took a while, and still hasn't fully recovered on people's faith and confidence in returning to the hospital for normal non-COVID type illness. And so that's an ongoing concern. And so it was a real challenge. There's no doubt about it.
We only have about a minute left. We'd love to get your thoughts on new therapies that you see coming down the pike to help treat this as well.
Sure. So we are, a lot of research has gone on here at Holy Name. We're one of the leaders in the world in terms of COVID related research. So things like the monoclonal antibodies, Regeneron, which is well known by a lot of people. Eli Lilly has a monoclonal antibody. When given at the right phase of the virus, those are extremely effective. And so we've designed a system here where you're diagnosed, you have a positive test. We try to enroll you immediately into an outpatient infusion center that's right near our emergency
Wow.
room, and get those monoclonal antibodies into people. We've seen great success with that. Remdesivir and other drugs are antivirals, and now the vaccines themselves and the new technology using mRNA to design these vaccines and roll them out has opened up a whole new frontier where that kind of technology can be used for a whole host of other therapeutic interventions in
Yeah.
cancer and cardiology. And so we've really opened the door to an exciting time of rapid acceleration and development in the medical field.